Hey parents, are there any means to verify labor progress apart of the pelvic exams? Yes, the answer is definitely yes. However, unfortunately, not everyone is aware of those methods, or even if sometimes care providers, if they are aware, they sometimes do not trust them. So yes, the pelvic exam prevails, determining if labor is progressing, and unfortunately in some settings mothers are disturbed as frequently as hourly to determine their labor progress. However, pelvic exam itself, they definitely do not make labor to progress, and on the contrary, they can even disturb this natural flow of labor. I'm Kata Rax, I'm a doula, I'm a Lama certified childbirth educator, I'm a mother of 2 daughters, and I am also the founder of the Own Your Birth childbirth education program. And I help you to gain confidence in birth and to make sure that you make your decisions concerning birth truly consciously, really informed, so that you can really shape your birth according to your values and your preferences, and not just let your birth become another hospital delivery, but really your big day, your life-changing celebration. And on my website, which is theownyourbirth.com, you can find different programs to help you in your preparations. And please do not forget to subscribe to my free childbirth workshops, because there I will teach you valuable insights to make your birth smoother and more enjoyable. But let us now go back to our topic. So how can you know if labor is progressing? So in a hospital, yes, pelvic exam prevails, and in some countries even hourly pelvic exams. But what is the problem with that? Well, first of all, giving birth, it's a very intimate event. Giving birth is the most intimate event in our life. But it is not just intimate, but this whole process is driven by intricate hormonal processes. And this means that external factors, your feelings, your stress level, they all can impact this process. And our hormones, you can also think on them as the messengers between the mind and the body. And there are 2 hormones which have really a very important role in orchestrating labor. And let's see for a moment those 2 important hormones. So oxytocin triggers the uterine contractions, and then because of those contractions the uterus changes its structure, and the fundus, so the bottom of the uterus, it gets really thicker, it gets stronger, while the lower part of the uterus gets thinner and the cervix gets as thin as a paper, and then it dilates. And the kind of enemy of the oxytocin hormone is the adrenaline. So the adrenaline type, rather I would say the stress hormones. So these hormones are increasing in our blood because of stress, which can be also a pelvic exam. So what is happening then? Then oxytocin shuts down, and that results that labor slows down, or even labor may stop. So the pelvic exams, they are actually a kind of source of stress. And if they are concluded, if they are done very often, then they can increase the levels of the stress hormone, and they can even disturb labor to unfold. But pelvic check is also an intervention which may increase the risks of infections to you and to your baby, especially if your membranes are not intact anymore. And it's not the rupture itself which increases the risks of infections, and this is not because of the rupture itself that providers may say that, oh, this baby needs to be born within X hours. But actually the risks of the infection increases because of the pelvic checks if the membranes are not intact. But okay, if a vaginal exam is not good for the mood because of the hormones, it's not good for the infections, then how can you or your partner know if labor is progressing? So I will teach you now 3 signs which can help you a little bit to interpret the events, and which can tell you how labor is progressing. And one of the most important elements of that is definitely the behavior. So the behavior of the person who is giving birth, because this works like a kind of signpost, really like a compass. But you need to know how a compass works. You need to interpret that. So for example, I cannot trust my 6-year-old daughter to find a way home from the forest with a compass. So the same is true for the behavior signposts. Because if you want to interpret those signposts, you really need to be present, you need to be open for those changes, and you need to be very attentive, and even better if you or the care provider knows the person who is giving birth, because then you really can know how her behavior is changing. So most women, they start with labor with a lot of excitement. They call to their friends, to their mom, they are in labor, they are chit-chatting, they are speaking quite a lot, and really very enthusiastic and very excited. So if that is happening, then this indicates really that this is just the very beginning. We are really at the beginning of the labor process. However, during labor, neocortex is gradually shutting down, so those brain activities are changing and the behavior is gradually changed, and after a while it will be driven much more by the instincts. So mothers are gradually turning inwards during labor. So after a while there is less chit-chat, there are no phone calls, the sentences are getting shorter, the eyes are closed during the contractions, and then later on, as labor is further progressing, then typically there is no spinking at all anymore during the contraction, and later on, not even in between the contractions. And as the labor intensifies, maybe there will be moaning, some loud sounds during the contractions, and after a while, very typically, mothers are starting a kind of rhythmic activity during the contractions. It's really like a kind of instinctual activity, like swaying or moving from one leg to the other during the contractions, or sometimes moving the head or knocking on sometimes. So that's definitely also a sign that yes, this labor is progressing. And then after a while, their eyes is becoming closed even in between the contractions. And if you are looking to a mother who is deep in labor, then she looks as if she would be drugged. And actually this comparison is not too far from reality, because in that stage the endorphin hormones are coming to help. And these are endorphin hormones which are helping those inward turning, and they are also reducing the pain sensation. And typically at this stage of the labor there is hardly any speaking, or if there is something, then just some sharp, very short one-word messages to the team, but nothing else. So no please, no thank you, just really sharp messages. And then the sounds are also changing. So the moaning may turn into deep vocalization, to sounds which are coming really deep from the throats. Some women are saying that these are sounds like cow. And then really mothers are turned very deeply inward, almost unconsciously about the surrounding. So that's definitely an indicator that labor, yes, it is progressing, and we are already definitely in the depth of labor. Another more objective sign can be the rhythm of the contractions, because the rhythm of the contractions changes as labor is progressing, and it changes almost until the very end of labor for most women. So they are becoming longer, they are becoming stronger, and they are becoming typically closer together. So if contractions are staying at like 5 to 6 minutes from each other, and they are not getting more frequent, they are not getting stronger, they are not getting longer, then it is very likely that there is also a kind of plateau in the dilation and in the progress of labor. But it's not definitely a problem, because every labor has its own rhythm, the same way as we are different. So every woman, every birth has its own speed and its own rhythm. On the other hand, if contractions are not getting stronger, it's not an absolute necessary sign that there is a labor stall, because there are some women who stay at this speed all the way till the very end, and babies can be born also if the contractions are just 5 to 6 minutes apart and if they are not getting longer and stronger. But most women, yes, they are showing a kind of evolution. But what is the third sign which indicates that labor is progressing? Well, this is really the most objective, and for this one there is definitely no practice required. However, this is also a sign which is not applicable 100% for everybody. And this sign is nothing else but the purple line. This is also called sometimes like dilation line. And what is that? So it is a temporary purple discoloration in between the buttocks in the anal cleft. And it is very strange because this phenomenon was described quite late in medical literature. So it was actually described in a letter written by two scientists, Brian and Edmund. It was written in a letter to the Lancet magazine when it was first mentioned. And they have checked 48 births, and they found that this purple line was present in 89% of the cases. But then later on there was also a real study about the purple line, about the dilation line, and it's a study made by Safford et al. And they published the result of their research about the purple line. And they have checked the purple line with 144 births, 144 mothers, and they found that it is present at 76% of the cases. And they also found that there is a medium positive correlation between the length of the line and the dilation or the descent of the baby. So in simple terms, this means that the length of this line indicates the progress in labor. And I have here a picture for you to show. I hope that YouTube will not punish me because of showing nudity, but here you can perfectly see what I am speaking about. And researchers are suspecting that this purple line is present in the anal cleft much more because of the descent of the fetal head than just the dilation. However, those two are pretty much interlinked, and that is also why there is hardly any change in the length of this purple line between like 4 to 7 centimeter dilation. However, there is a lot of change before because it really appears at the beginning of the labor, and then also after 7 centimeter it really increases a lot. And scientists also suspect that this phenomenon is because there is a blood congestion behind the sacrum. And as the baby's head is descending in the pelvis, then the baby's head is pushing outwards the sacrum, and that's where there is a kind of blood congestion. And because it's in the anal cleft, but there is hardly any other tissue in between the bone and in between the skin, that's why it is visible at this point of the body. And also very important to know about the purple line, that this is much more visible if someone has a light skin color. So obviously the darker the skin, the more difficult to see this discoloration. Also another interesting fact is that this purple line is much more often present if labor starts spontaneously. However, it is less present or less frequently present if the birth has been induced. So it is very likely, however this is only my own personal speculation, that also for this purple line somehow all the puzzles of birth behind the scene, they need to fit together the same way as for the spontaneous start of labor. But to keep the story short, so yes, this purple line can be a good indicator of labor progress for many women. And of course, asking a mother during labor like every 5 minutes to show her butt, this can also be very disturbing. So this can actually be equally disturbing as a pelvic exam. However, if mothers are allowed to choose their birth position freely during labor, it is very often that they are on hands and knees or they are leaning against something, and that in such positions, if they are not wearing any clothes, then this purple line is really very visible, and it can be a good indicator for the birth team to know, to decode how labor is progressing, especially together with the emotional signposts and with the pattern of the contractions. And if you would like to learn more, not just about the purple line, not just about the signposts of labor, but also to understand the benefits and the risks of the most common obstetric interventions, to be better equipped with pain management strategies, or to know more about birth variations and birth complications, and learn how to advocate efficiently for your baby and for yourself, then please visit my website. So this is the ownyourbirth.com, and I can help your birth preparations with evidence-based childbirth courses so that you can make truly informed, conscious decisions about birth in order to shape this fantastic experience according to your values and your own preferences. And then on my website, please also subscribe to my free childbirth workshop, where I will give you practical tips how to make your birth smoother and more enjoyable. So see you on the workshop. Bye!